Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us this week, Sierra Drevline. She is our new Director of Employee Health Services. Welcome, Sierra, and thanks for joining us.
Thank you for having me.
It's a pleasure. In your position, you play a key role in Masonicare's COVID-19 vaccine initiative. How has that process been going so far, and what is still ahead?
So the process is going exceptionally well as we continue with our vaccine clinics. So we use CVS and Walgreens as our pharmacy partners. We started this venture in December, and our organization has had over 36 clinics thus far at our different locations and have facilitated in providing thousands of doses to residents and staff. We've made these crucial symbiotic relationships with our pharmacy partners who provide the immunizers and the vaccine, and we provide the space and the recipients. We've had a very successful collaboration in that we share knowledge and work hard towards a common cause. Still ahead are a couple more vaccine clinics in which we are including all of our Masonicare employees and residents that are in our facilities. So we continue with our clinics through March, and we eagerly anticipate more collaboration in months to come.
That's wonderful news. And JP, I know that you made the decision to require vaccination for employment at Masonicare, and that's something you feel very strongly about.
But first, I want to thank Sierra for all that she's done. This has been a heavy lift to get all the vaccines out and working with all our care partners. And Sierra has been one of our leaders that has allowed us to get out the vaccine to thousands of our employees and residents. So I wanted to personally thank Sierra for all that she's doing, because without her leadership and working with all the affiliate heads and everyone in the task force, we wouldn't be where we are today. So Sierra, thank you for all that you've done. It's truly appreciated by myself and really our residents and staff for what you did. So thank you for that.
It's my pleasure.
Well, when you look at where Masonicare has been, we're on day 318 since our first case. And I can't tell you how proud I am of what our staff have done, and how proud I am of our residents who have had to endure all the isolation, the challenges that they've been faced, and they've come through and done fantastic. But we've seen what this virus can do firsthand. And knowing that the vaccine can really get us to some normalcy, if you will, is truly important to me. And making it mandatory for our staff really is one that we truly believe in, for the simple reason we could bring it in and give it to our residents and give it to our patients. And because we've seen this firsthand, we know it's the right thing to do. We know it's the ability for us to combat this virus, both internally but externally. And because of that, I truly feel that having this vaccine mandatory for our employees is the right thing to do. And I always tell my staff that the right thing to do doesn't necessarily mean it's the easiest thing to do. It's typically the harder thing to do. And I truly understand some of the hesitancy of our staff that may sit there and say, well, I don't know enough about it, or I'm concerned. I will tell you that Dr. Schwartz and his vaccine task force has done a fantastic job at educating the staff, getting the communication out there. And I'm happy to say we're seeing a lot of our employees take the vaccine, and we're not seeing significant side effects. So I think that is I think quailed some of that anxiety. So I think we continue to do it. We continue to get the vaccine in. We're going to get it to some normalcy very soon once we do this.
Thank you, JP. And finally, Dr. Schwartz, as we continue to vaccinate here at Masonicare and in our communities at large, it's still very crucial for all of us to stay vigilant to help prevent the spread of this virus, correct?
Absolutely, Sandy. And, you know, I want to join in JP's sentiments to congratulate Sierra and all the hard work that she's done. She's done a fabulous job. And, you know, tomorrow is actually a monumental day in Connecticut, in that Governor Lamont has authorized residents, people 65 and older to get the COVID vaccine. And this is a big step. And, you know, what I think we all have to realize is it's not like you just go down to a center. What center do you even go down to get the vaccine? It's a whole, involved process, and that you need to register. There's a lot of steps that need to be done. And I want to give a special thanks to my colleague and friend, Adam Rader, because he came up with which I have here, a very nice, concise one-page sheet that kind of summarizes everything that you really need to know and helps you walk through it. And I'm not going to read everything, but I'm just going to kind of highlight a couple of things. And he did say if you wanted to find available vaccination clinics throughout the state, you can go to ct.gov/COVID vaccine and you put in your zip code. There's also something called VAMS online, and that means a Vaccine Administration Management System, and that can help you find and schedule appointments to multiple clinics across the state. And there's a COVID-19 Connecticut COVID-19 vaccine appointment assist line, and it gives a number 877-918-2224. Then there's listings of like Hartford Healthcare, Yale, and Stanford, and how you can get appointments there, as well as various pharmacies, Walgreens, CVS, and Walmart. So I think that's fabulous, and it kind of helps everybody feel more at ease, especially like people from my generation that didn't grow up with computers, So just a little bit of statistics. It's like, to date, roughly 32 million Americans got at least one vaccine. And in the United States, we average about 1.3 million shots per day. And Connecticut's almost at the top of the list as far as immunizing their residents. And we've so far immunized about 10% of the population. Well, what does that really mean? If you think about it, 10% have been immunized, but 90% haven't. And as we talked about in previously, even if you've gotten vaccines, you can still be an asymptomatic carrier. You can carry the virus in your nose, your mouth. And if you're not wearing a mask, if you're speaking or coughing or sneezing without the mask, you can transmit it to these 90% of people that still haven't gotten the vaccine. So we follow, and I recommend CDC guidelines, which still say wearing your mask, and as we talked about last week, masks that fit properly and prevent any kind of gaps and things so the virus can get through, hand washing, avoiding large crowds, social distancing, still avoiding travel, and probably most importantly, getting your vaccination. And I'm going to just read my inspirational quote for the week to you. This comes from the Dalai Lama, actually, who said, it is under the greatest adversity that there exists the greatest potential for doing good, both for oneself and for others. And I can't think of a greater adversity than what we've been going through with this pandemic. But I know if we continue to work together and persevere, follow all the CDC guidelines with getting vaccinated and wearing masks and so forth, we're going to get our normalcy and our life back. And I want to thank everybody for all their hard work and diligence, and just wish everybody health and peace. And thank you.
Well said.
Always the perfect words. Thank you so much. And thanks to all of you for sharing your time and insight with us today. We appreciate it as always. And we appreciate you joining us at home. Until we see you next time, we hope you'll stay safe and stay well.